On behalf of the Colorado Health Institute in partnership with the Center for Bioethics and Humanities at the University of Colorado's Anschutz Medical Campus, we want to sincerely thank the Denver Foundation for making this all possible. There will be time for questions, at which point please use the Q&A box found at the bottom of your Zoom screen to submit questions for the panelists. If you are joining us on Facebook, please note that we are not monitoring comments submitted there. With that, I'm thrilled to introduce Javier Soto, the CEO and President of the Denver Foundation, for our introductory remarks.
Thank you, and good morning, everyone. Thank you so much for joining us. Here in Colorado, as we all know, we're dealing with quite a bit that 2020 has brought. Right now, we're in the middle of a new surge of COVID cases that's impacting our state in pretty significant ways. We've had wildfires have a significant impact on large numbers of the population of the state over the past several months. This summer, we saw an eruption of emotion and feeling around the racialized deaths at the hands of law enforcement by several citizens throughout the United States. And just last week, we witnessed perhaps the most divisive of presidential elections in our lifetimes, which actually is not even officially over yet. These traumas can feel overwhelming and unceasing. And as the holidays approach, many of us are wondering and struggling with how to come together as a family in light of all that is going on around us and the concerns around travel and just being around each other. We're all experiencing profound loss, but for people of color in particular, these losses have been compounded. People of color are the most harmed by this pandemic, and several studies and surveys have already demonstrated that quite conclusively. We know that climate change disproportionately impacts people of color as well. And lastly, our economic system also disproportionately has adverse impacts of color. We see all of that quite clearly today. The Denver Foundation realizes this and recognizes that it is not only unjust but unsustainable for our community. We need ethical leadership, and we need to engage in community conversation around solutions to all of these many challenges. We need a North Star. We need to know where we're heading as a state, as a community, and we need a new better. That new better, in my mind, means a resilient future that is equitable for all people. Today's subject is mental health. I'm excited about this panel discussion and the collaboration that went into building this session today. We need more understanding, we need more compassion and empathy. We need to infuse more justice throughout our society. Our hope is that you'll leave this conversation with hope and frankly with some actions that you can take from today and deploy in order to contribute to this new better. So with that, it's my pleasure to introduce to you our moderator for this discussion, Matt Wynia, who is the director of the Center for Bioethics and Humanities. Matt?
Thank you so much, Javier, for that really thought-provoking discussion. You actually pirated some of the things I was about to say, so I'm going to jump straight to a couple of framing comments, because in the public health arena, we sometimes use the word syndemic to describe the confluence of multiple streams that all lead in the same direction towards an adverse health outcome. And I think you could fairly describe the things that you just articulated, the confluence of the pandemic, the racial justice movement, the climate justice movement, the political environment, and all of those, unfortunately, come together to create adverse health outcomes, adverse mental health outcomes that are worse than they would have been without any one of those streams. So they blend together and make things worse. So a syndemic is one way to think about this, and a syndemic, I think, is nicely understood as a complex adaptive problem, as opposed to a technical type problem, right? So a technical problem might be something that is difficult. It may even be complicated. It may be expensive to deal with, but there is a solution to a technical problem, and it's a technical solution. And unfortunately, when you're talking about a syndemic, you're really talking about complex adaptive problems and therefore complex adaptive solutions. And when that's the kind of environment you're working in, the tools of ethical leadership get a little more complex than they do if you're dealing with a mere technical problem where everyone agrees what the problem is, and we just have to figure out how to pay for the solution, right? Those kinds of problems. When we talk about ethical leadership, we often break this down into 3 different components, and we're going to do that as a framing device today. It's not the only way to think about ethical leadership, but it is a useful framing device for talking through sort of the steps of leading through an ethical challenge facing a community or a society or an organization for that matter. And step 1 is recognizing the type of problem that you are dealing with, being aware that the problem you're looking at is not merely a technical problem. It's one that has these values behind it, that has complexity in the solutions, and where any solution you try to implement is liable to have both pros and cons, that you'll see blowback. You'll see, the balloon gets squished in one direction and it pushes out somewhere else. So how to build awareness amongst your community that you are dealing with a complex adaptive problem that is that will require more deep thinking than a simple solution might. And by the way, I say this because it is really common for people to want a simple solution to a complex adaptive problem. I'll use this as an example, even though I know it's politically charged right now, but the idea that you could fix the issue of immigration by building a wall. That is a technical solution to what is fundamentally a complex adaptive problem. And building a wall will have an impact. It will have positive impacts, it will have negative impacts, it will have a lot of repercussions, right? But it will not, in the end, be a simple fix to what is a very complex problem. So how do we get people to recognize when they are dealing with a complex adaptive problem? Second is, how do you analyze these problems? What data do you need? Who needs to be at the table? What are the important values, and how do those come to play? So the awareness that you're dealing with a complex problem is not enough. You also need to have an analytic frame for looking at the problem and choosing mindfully a path forward. And then third, which is probably the step most often forgotten by people who are not in the advocacy arena, which is, how do you take your chosen path and actually make it happen? So the action step is often the most challenging. And I work a lot on our ethical leadership program with a woman named Mary Gentile, who does work on giving voice to values. And she makes the point that in most of the business ethics scandals, it is not the case that no one in the organization knew that what they were doing was wrong. So they were aware that they were dealing with an ethical issue. They had done an analysis and knew what they were doing was wrong. What they were unable to do was change the organization. What they were unable to do was act according to their values. And so we're going to spend a little bit of time today, because this is so important in the advocacy arena, to not just recognize the complexity of the issue, not just know the path that you ought to be on, but how do you actually get people to walk that path? What are the actions that you can take to behave as an ethical leader in this kind of a complex environment? So with that, I'll introduce our panelists. The Reverend Timothy Tyler is the pastor of Shorter Community African Methodist Episcopal Church in Denver. By the way, the more comprehensive of these bio sketches were mailed out to you, emailed out, and I think are being put into the chat as well. So I'm going to be giving very truncated introductions here. Reverend Tyler is a well-known social justice advocate who's organized and facilitated several community events to bring awareness to the pervasive spread of homophobia, xenophobia, misogyny, and gentrification. Welcome, Dr. Tyler. Dr. Ben Miller is the Chief Strategy Officer for the Wellbeing Trust, a national foundation committed to advancing the mental, social, and spiritual health of the nation. Previously, Dr. Miller was Associate Professor at the University of Colorado School of Medicine, where he was the founding director of our Farley Health Policy Center. Welcome, Dr. Miller. I'm going to skip one because we're missing one panelist for a moment. Dace West is Vice President of Community Impact at the Denver Foundation. She is recognized as a forward-thinking leader on affordable housing, economic development, resident engagement, transit equity, and other issues for the Denver area's low-income and vulnerable communities. Welcome, Dace. And then finally, we hope we will have joining us Leslie Harrod. She is in a committee meeting as we speak. And it is, we're still hopeful she'll get here by the time we wrap around to the question I have prepared for her. But Leslie Harrod is a representative in the Colorado State House, elected in 2016 as the first LGBTQ African American in the Colorado legislature. She was named this week to the Joint Budget Committee, which is why we could have predicted she might not be here for the entirety of the program. She championed the Caring for Denver ballot initiative in 2018 that raised $35 million annually for mental health and substance abuse services. So that is our panel. Michelle, was I supposed to introduce you before we get started? No, okay. We will come back to Michelle Leek, the president and CEO of the Colorado Health Institute shortly after a little bit of conversation. So I want to start with Dr. Timothy Tyler. Reverend Tyler, since the pandemic began, and this is our question sort of around building awareness of the nature of the problem we're dealing here. Since the pandemic began, you have really been a firsthand witness to people becoming aware of these complex interactions among health, economic, moral, and political systems, and these converging pandemics, if you will. How do we build understanding among people who may be focused primarily and understandably on their own personal experience? And their personal experience may end up being really tightly focused on, say, the economic implications of these pandemics. How do you build awareness of the complexity of the multiple pandemics that are converging and are becoming more apparent today?
Thank you for that question. And I want to also thank you for allowing me to be on this panel now. Because I'm a Black preacher, I talk for a long time. So I hope you won't charge my thank you time against my question time. I'm just grateful to be here. And it is a good question. Not only have I've experienced people becoming aware of what's happening, but I've witnessed persons who have been victimized by this season of crisis. And I want to say that even more than witnessing people becoming aware of what's going on, what I've noticed is that we, especially Black people and persons of color, have been able to put language. We've been experiencing the ravages of these pandemics for over 400 years. We've called it white supremacy. We've called it systemic racism. And now we've put another word to it that has not been used often in our lifetimes: pandemic. The last major pandemic we've experienced was in 1918, and I myself was not here in 1918, but I'm here now. And so I think it has helped us to put a word to what we're experiencing. And I heard you use the word syndemic, S-Y-N, which kind of implies that all of them have the same characteristics. I guess because I'm in the church, we would also call it syndemic, S-I-N. It's immoral what has happened and what is happening to human beings. And I think that when you tell us that it's out of control, it affects a lot of, it affects a lot of people, and there is no cure for it, then pandemic is a description of what many Black people and persons of color have experienced throughout their history. At least there's no cure that we want to have for it. And I think if to speak to the question of how do we convince people who are only focused on the part of the pandemic which has affected their lives, I think that what we have to help people to understand is like white supremacy and like systemic racism. And I have dedicated my life to trying to help people understand the nature of what's happening in systemic racism, is that you cannot just focus on what's happening in terms of what you see as your downfall. In this pandemic that we're living in, COVID-19, there are many people who are saying, open up the nation, open up the country, open up the world. It's gonna kill us economically. But what we have to get people to understand is that having that attitude is like being on the Titanic and just moving the furniture around. What people have to understand is that if you open up your business, but your employees are sick and dying, and the people who come into your restaurant or into your store are sick and dying, you're going to be economically ravaged anyway, because there will be no one to take advantage of what it is you have to sell them or to offer them as a product. And so I think we're going to have to continue to help people see that there is an interconnectedness with these pandemics and with this syndemic that will have to be recognized and acknowledged so that we can do something about it.
It's such an important point. The generation of new language is sometimes, it strikes me as really critical to sort of bringing people from the back of the class to the front of the class, right? I'm reminded of this metaphor that I've heard before, that there are a lot of folks who've been at the front of the class with regard to these converging problems for a long time. Yeah. Who've been very aware of these converging issues of climate justice, economic justice, racial justice, and how they come together to create adverse outcomes in communities of color. And it's now the folks in the back of the room are becoming aware of what folks like you have been working on for generations.
Sure.
Ben, Dr. Miller, I want to turn to you next to talk about the analytic frame here. What does research tell us about the effects on various people of these converging pandemics? And especially, I know you've done a lot of work on deaths of despair and the long-term and short and long-term mental health implications of these converging problems.
Well, first of all, thanks, Matt, for the opportunity to be here. This is going to be a great discussion. I'm proud to share the stage with such amazing leaders. I had an advisory board meeting yesterday, and the chair of our advisory board, Maureen Bisiano, she has this saying that when something isn't working, it's unethical to proceed as if it is. And she comes from healthcare where that's very much the case. But I actually want to apply this truth in her statement to the things that aren't working in this nation right now. And I think we just heard a little bit of that from Reverend Tyler. When we hear people say, I just want it to go back to the way it was before COVID, the way it was before COVID wasn't working for most of us. And it definitely wasn't working when it comes to our nation's mental health. All the data points show that we're going in the wrong direction. So let me talk about the data in two different camps here. There's the before COVID. So you mentioned deaths of despair. For those not familiar, these are deaths to drug, alcohol, and suicide. And they're really driven by social, economic, and health-related factors. The US has been working to address them without much success. The data have shown an increased trend over the last 20 years, 2 decades. We've been watching a slow train come right at us, and we stand right in the way. Take the case of opioids and opioid overdoses. Just as we were beginning to get a handle on misused prescription opioids, fentanyl and synthetic opioids have really come to the foreground. 2 decades ago, these drugs were linked to fewer than 1,000 deaths each year. In 2017, which is the last big tranche of data we have, fentanyl and synthetic opioids killed more than 28,000 Americans.
And nearly 72,000 Americans died from drug overdoses in 2019, which is a 5% increase from 2018. So we continue to see deaths from drug overdose remain higher than the peak yearly death totals ever for car accidents, guns, or for AIDS. And so most people, when we think about this, they don't realize that undergirding this massive pandemic is this huge problem that we had not yet grappled. So COVID's hit, and drug deaths have risen an average of 13% so far this year over last year. And this is according to mortality data that was collected by the New York Times. So when we begin to look at the surveys that are out there, they show things like a threefold increase in depression. According to the CDC, Center for Disease Control, almost half the country reported mental health symptoms in June. We personally invested and worked with Kaiser Family Foundation, and we did our own surveys on this. We do it actually every other week. And we've shown that over half the adults, about 56%, report a worry or stress related to the COVID outbreak that has caused them to experience at least one negative effect on their mental health and well-being. And this could be things like sleeping, eating, increased alcohol use. And no surprise to anyone, which is something I hope we do talk about as well today, stress and worry abound when it comes to our frontline healthcare providers. 64% of them describe being worried about themselves and their families, as well as those individuals who are frontline healthcare providers that have been furloughed, which seems to be almost impossible right now because we need everyone we've got. People are going to the Mental Health America website to complete screenings on depression, 500% more than they did at the same time last year. For anxiety, 600% more. So there's this triple-headed thing that's hitting us right now. And I think it has to do with economic failure, with massive unemployment, mandated social isolation for months, and possible residual isolation as we're living through now for several more months, if not more years, and then uncertainty. And the literature is clear that unemployment and these economic declines are risk factors for things like suicide and drug overdose deaths. And don't forget about loneliness. I mean, here we are in our homes doing these webinars and talking to each other, but a lot of us are still lonely. There was just actually a survey that came out yesterday that looked at the loneliness rates are highest in folks in their 20s. So we're going to have a major second or third or whatever wave you want to call coming our way, and it's going to be built on the back of mental health. So what can we do? Let me give 3 quick things, and then I'll hopefully we could talk about these more. Number one, and this is a biggie right now, especially considering that President-elect Biden has announced a COVID task force. We need to include mental health experts in state and federal task forces addressing COVID-19. I have not seen this yet, and maybe somebody's doing this in Colorado, I'm just not familiar, but it hasn't happened very well nationally. What we've found is that other countries that have not had mental health lead involved in their planning, that mental health response is disjointed, it's fragmented, it's fractured, and it's marred by resource waste and reduced effectiveness. So we got to get leaders that know the mental health problem in there right now to begin to talk about what we can do. Number two, we need to use this opportunity, I think, to rethink our structure. And when I talk about structure, yes, I'm talking about healthcare, but there's a lot of structures that need to be rethought. So COVID right now presents an opportunity and a challenge for us to consider the integration of mental health and where it's been left out. From our schools to our workplaces to places like primary care, we have an opportunity to rejigger some of those things that weren't really working and to create a new structure for care. And finally, I think we need to create a new workforce to address mental health and addiction. I mean, just imagine what would happen if it was recommended that our leaders equipped contact tracers and places at point of distribution sites one day with mental health expertise. I mean, what would that look like? We would be asking different questions and assessing and screening in ways that might actually detect more cases. Now, you got to have a system to take care of those folks that are identified, but I'm saying we have an opportunity here to begin to engage other folks in a dialogue. We need to create a new workforce, one that is made up of not just increasing more licensed clinicians, but we need to create a workforce that's made up of everyone in our communities who are more comfortable to talk about issues of mental health and addiction, who are able to have techniques to use to help folks that are their neighbors, their friends, their colleagues, their coworkers, so that our response isn't, well, I don't know what to say to you, just, hopefully you'll get better, or go to the emergency department. There's got to be a new way to think this through. The former Surgeon General, Vivek Murthy, who's one of the co-chairs of the task force, he's talked a lot about the importance of service and how that can help us in healing and getting out of loneliness and isolation. Well, what happens if one of the greatest service opportunities we have right now as a nation is to actually be there for one another? I know it seems a little bumper stickerish and something that feels light, but there's a robust evidence that when we can apply evidence-based or evidence-informed techniques to how we interact with everybody, including our friends and our family, people do get better. So in closing, I think it's important to have hope. I mean, COVID-19 has been a magnifying glass for so many issues in this nation, from racism to climate change to public health responses. Underneath all of these cracks, there's a flawed structure of health and well-being. It's a structure that leaves integration as an afterthought, and really a structure that's not able to bend things like the mental health curve before COVID and won't be able to after COVID. So as I mentioned at the top, I think things aren't working. So therefore we must change our course or else remain committed to unethical practices that I just don't think are going to help any of us. Thanks, Matt.
Yeah, thank you, Ben. That is such a useful set of data points and a depressing set of data points. Honestly, you're reminding me that we actually knew some about this from prior epidemics. So not pandemics that affected the whole world, but I'm thinking of the SARS epidemic, for example, in 2003, when a full 25% of the healthcare workforce in Toronto, which was hard hit by SARS, but 25% of the healthcare workforce there was left with PTSD symptoms. It is difficult, and we're seeing this now across the entire globe, where healthcare professionals are really struggling through this. Rep. Harrod, I'm so glad you were able to join us. Thank you for stepping out of committee to join us. You're just in time. I was about to direct a question to you. We've talked a little about awareness raising amongst the communities that we serve in terms of the complexities of the issues that we're talking about. And then Dr. Miller just finished giving us some data and a few ideas for a path forward. And I'm wondering if you'd be willing to talk to us a little bit about, once you sort of know what the path forward should look like, how do you actually get people to walk that path? So we're aware of the problem. We have some solutions on the table. Often the hardest part of ethical leadership is action, is getting people to move, right? Our political and social structures are often either just slow to act or they're actually resistant to taking the actions that are appropriate and ethically justified. How have you thought about overcoming that inertia and that resistance in your own work? And what should other civic and professional leaders be doing right now in terms of moving people to action together?
Yeah, I think that is such an important question. And it's one that I deal with a lot. And we need to talk about it right now, right? So I'm sitting on the Joint Budget Committee and I came over to the Joint Budget Committee because I see how people might even acknowledge a problem really exists, but then in government don't actually put the resources behind actually fixing those inequalities, right? So we hear a lot about Black Lives Matter. We hear a lot about now the racial injustices that have been unearthed again by COVID. But we don't actually always see it in our policy making, because that means that elected officials actually have to deal with competing priorities. And what they say that might be popular, they actually can do something completely different and people not notice. So how do we address this, making sure that we have ethical leadership, and then also that those ethical leaders then take what they're saying and what we know to be true and translate that into policy and actual change for our communities? One, I'd say make sure that you start with electing people who care. I think so much about politics is lost in the fact that people think, one, other politicians don't care or they shouldn't care. And they elect politicians who are not empathetic, right? Or leaders who don't actually care enough about the communities that they're supposed to serve. And I say that because it really does show its face when we are having these behind doors, closed scenes conversations about where our priorities should actually be and how programs are actually implemented. It's easy for me to come on this panel today and tell you that I believe that everyone in Denver, everyone in Colorado should have access to the same resources. But we know that it's not about just giving everyone $50 and saying we're all good, It's more about instead leveling the playing field. And that means competing priorities are going to butt heads, right? And if you don't actually care about the communities that you intend to serve, it's not going to be very hard for you to decide to turn your back on them when it actually comes to the budget setting process or the policy making table, And we see that play out a lot. So I say start with electing people who care and who come from the community, ones that you can actually trust to get the job done, and know that maybe we all have good intentions, but when the priorities are competing with each other, that's when our actual personal values really do come into play. The other thing I will say is make sure that you're not just electing showboats either, because part of the hard work of being an elected official or being a leader is not just to say what sounds great and even maybe what you believe in, but you actually have to get it done, and that requires compromise and conversation. And so one thing that I think is really important is that we do that work. A lot of times people see a lot of praise for folks, maybe even, let me give you an example, AOC. You might get a lot of praise for someone like AOC because she puts herself out there and says the things that are popular to her constituents. But in shifting from a candidate to an elected official, what people don't see is that she's actually extremely effective in working behind the scenes to bridge the gap between progressive and moderate Democrats to actually make real policy change, and still have that message to the community and still speak to the community and still be connected to the community. But it goes beyond just saying the things that might get the most attention, and it actually goes into the work that she puts in. This is what I try to do in my work too, I don't think I would be a good elected official for House District 8 if I wasn't actually effective, right? I could say a lot of things that sound good, but if I can't convince my colleagues to get in there and act, we won't see the change. So when it comes to ethical leadership, it's really important that we have our core center values that are ingrained and a part of our community, and then that we take those values into these negotiation tables. We take those values into the policymaking tables. We bring an equity lens into every single thing we do. No one thinks I'm going to go on the budget committee to make sure that we have equity lens there. They might go on human services, they might go on judiciary, but this is where it needs to be too. It needs to be everywhere. And that's the work that we're doing. So I am just really excited to be here. Thank you so much for having me and working with my schedule. I look forward to hearing from the other panelists and answering any questions you all may have. So thank you so much.
Thank you. That was I was taking notes, and I came up with a series of C's, and I don't know if this was intentional on your part or not, but the issue of being connected and caring within the community. Connected to values, but also connected to the people that you serve, but willing at the same time to enter into conversation and to look for areas of common ground and compromise. Very interesting set of points. Dace,
I love that. Will you send that to me afterwards? Maybe I'll continue to use that. Thank you.
Dace, I want to wrap you into the same action-oriented step here, because you come to us as a representative from a major foundation, and many of the foundations really stepped up to the plate early and rapidly in the pandemic to offer immediate relief and short-term funding for organizations and individuals who are really suffering in the near term. And what I want to ask is, how are you thinking about making the transition, if you will, from that sort of emergency short-term funding necessity, the relief programs that you had to put into place right away to get people, through this year, as we emerge from this pandemic, this set of pandemics, how do you think about addressing the causes of these pandemics, about these sort of underlying factors? And I want to throw a little bit of a curveball at you, because having heard Representative Herod just now, I'm also curious how you see your work and the work of private foundations as integrating with or being complementary to the policy and budgetary work that happens on the governmental side. So how are you making this shift from short-term to long-term problem solving for the underlying issues?
Yeah, it's a great question. We did jump right into COVID relief right away. We were one of the first out of the gate to get dollars out the door all across the state. We expedited our grant making process. We had a special quick grant making process that took 10 days. Typically our grant making takes 4 to 5 months. I mean, we were all about really getting dollars out the door to address things like food insecurity, housing insecurity, and other things that we knew that people were facing immediately. But after a couple of months, we really started to think about, what does recovery look like? I like the way that Dr. Dollar framed this question of, mental health really being about social and economic factors. I would add, also about racial factors. And unless we were really digging in and addressing those, we weren't actually getting to the root of the problem. And that means more than some of the work that we had been doing prior to the pandemics. We have the Colorado Health Access Fund, which has created opportunities for access to behavioral health care for over 87,000 people across the state. But we know that that's not enough. We have to really dig in underneath and really think about, what does public health look like and how do we address the disparities there? Even something as simple as having a vaccination plan in place that really takes into account what those disparities look like from a racial perspective. How do we go back to the work that we've been doing for years around local economies and really support our local entrepreneurs through training programs and really invest in businesses through low-cost loans? Are there new ways that we could deliver social services? We have work that we're doing around violence interruption and really making sure that communities are caring for each other at a community level. Ensuring students are able to learn during this pandemic, especially those with the greatest barriers. Investing in adoption of broadband and other things of that nature. And really focusing not just on cuts that we know are necessary in state and local budgets, but on revenues. And I think that's a place that kind of takes me into the policy arena, is that I think there's 2 ways that philanthropy works well with government. One is that philanthropy can be a voice and can be a place, a convening place to have dialogue about important issues. We can support policies and we can really stand up for things that impact the communities that we're serving, which are the same communities that the people who are in elected office are also serving. We also have the opportunity as philanthropy to really act as the innovators, to be able to go in first, to be able to go in at a somewhat smaller level. We don't have the same resources that government has, but to be able to say, this is a really interesting approach, and this is something that has a lot of potential. Is there a way that as philanthropy, we're able to lift that potential up and hold it in our hands by providing resources so that that can be recognized, acknowledged, and eventually adopted at either a local or a statewide level. And those are the times that I see philanthropy working the best, is when that's happening individually and in community, and when it's happening collectively across different foundations who recognize that there are root causes to all of these problems, and that unless we're really digging into the racial, the social, the economic components of each of these problems, we're not getting at the real impact and the real outcomes that we're looking for.
Thank you so much. I think I'm supposed to move now because we have probably 10 or 15 minutes left for questions. Michelle, am I turning things over to you? That was a rhetorical question. I'm turning things over to you. So Michelle.
Thanks, Matt. I'm Michelle. I'm the president of the Colorado Health Institute, and it's nice to be here with you today. I'd encourage people to send questions to the Q&A. And we'll sort of filter those right on to the our panelists. Dr. Miller, there's a question for you having to do with the opportunities that you think might be. Is the time ripe, or are there opportunities that have come to light, particularly around your comments of workforce, and how do we think about one of the questions that we've been asking is, as we think about emerging or re-emerging into a new, better, how might we think about and fund a workforce that addresses the behavioral health issues that you've shared with us today?
Thanks for the question, and thanks, Michelle. So I think if you go outside the United States, you can find examples of this everywhere in other countries, where people, I mean, from training grandmothers to talk to men in their villages about depression, to folks that are working the same, communities together, working in the same jobs. There's a lot of opportunities out there to take what's called task sharing, which is what the World Health Organization has called this, and teach them to everyone. And so if I were, a trillionaire for the day, and I was thinking about ways to invest dollars really concretely in communities, I would think about an infrastructure that would allow us to consistently provide some level of training to folks wherever they might be. And I would start with certain community-based organizations. I mean, we've got Dr. Tyler, Reverend Tyler on here. I mean, I would look at our faith parishioners. I would look at the folks that are leading congregations. They have a built-in constituency right there to be able to begin to talk about issues of mental health. I would look at places where we get our haircut or where we used to get our haircut, and like train folks who have daily contact with people, who have relationships with people, on how to begin to better address and identify issues of mental health. And the answer to that can't always just be, okay, what I said earlier, like, okay, well, go there, or you need to call a psychiatrist, or should you go to the emergency room? It really needs to be embraced, because we all each need to be taught something more comprehensive on how we respond to one another. So my thing, and I'll be quiet on this one, is that you can invest a lot of resources in getting more clinicians. And that's great. Some people should do that, but you're never going to have enough clinicians to meet the demand in the communities. And you're also not going to have enough clinicians that can be culturally competent to meet the folks where they are in communities. So why not train the communities to be in a place of leadership where they can step up and provide some support for one another? I think that's a great place to start, and I'm happy to talk more about it, but I'll stop there.
Great. That sort of ties into another question that we have, Ben, and maybe this, Reverend Tyler, you can chime in here. Ben is advocating for more of us to be involved, more community members to be involved and embrace issues of behavioral health. Rick Padilla has asked a question about youth, and we've seen a lot of demonstrations and marches and protests and a lot of interest in activism. Reverend Tyler, tell us about how we can harness some of this for the greater good as we re-emerge from the pandemic.
Yeah, thank you for that question. I have personal stories around that whole issue. I've always considered myself an activist, and when I got to Shorter, I was 12 years younger, and they bought me a bullhorn, which was to me like getting a Bible. So I go out and shout in the streets. And during this pandemic, I learned that my role has changed when a news reporter called, and I knew he was just calling. He left a message, "We want to talk to you." I knew they were calling me to ask me about my activism and what I plan to do and what my plan was for getting out in the streets. And when I called him back, he said, "Yeah, we wanted to talk to you because we talked to a few younger people, and they said you were their example, and you were the person they looked up to." So at that point, when I got that call, I realized that I am now in the older section of, I'm in the balcony now of people who other people look up to. And so just to even bring that home further, my son was living with us at the time. He had just gotten, he's a graduate of Morehouse and just moved to Denver. And when the uprisings and the Black Lives Matter uprisings were hitting in the street around the same time as the pandemic, he and I were kind of having it because I was telling him I didn't think he should go out there, and he should stay home. It's too dangerous. The health risks are too severe, and yet at the same time, I could see that he had the passion in his eyes to want to get out in the streets. And so he said to me one day that instead of telling them all the reasons why he couldn't go, that he thought maybe I should affirm the young people and encourage them, and at the same time give them advice on how to be safe while they do it. And so he schooled me. And what I understand is that there's a generation of our young people who want to get out in the streets, and it's the same as when my generation, we had the passion to get out in the street. My parents were civil rights activists in Mississippi, and they got out in the streets. And so the only risk now is that while they are in the streets fighting the racial pandemic, there is the risk of the COVID pandemic. And so I think for us, we're going to have to continue to encourage them to be safe, to do the things that will give them safety. But at the same time, we're going to have to let our young people lead, and we're going to have to let them protest, and we're going to have to let them see that they can be as effective and affirming and as powerful in leading this movement as we thought we were when we were leading our seasons of the movement. Everybody's going to have to do what they can do from where they are, as opposed to just allowing things to stay the same. I appreciated Leslie talking about the work that she's doing. And at the same time, I realized that there's work that the politicians will do, and there's work that the activists in the street will do. And we all got to work. We all have to work together to see it get done. And so we're going to have to affirm young people, recognize, and at the same time, Ben, you're exactly right. We're going to have to provide the we call it pastoral care in the church, because we understand I'm not a counselor. I am not a trained counselor. And I often tell people that I'm a paramedic. It is my role to check your vitals, to see if you have a temperature, to hook you up to the machines until the professionals can get to you, those who are trained to do what they need to do. But all of us are going to have to learn how to be care professionals, even for our young people and our youth, because even being out in the streets can give you PTSD like you've never experienced it. And we can't ignore it. We've got to be aware of it. But at the same time, the fight continues.
Great. So harnessing and allowing this young generation that you're watching from the balcony, Reverend Tyler, and supporting them through and through. Representative Herod, we turn to you because there's a lot of questions that we're seeing in our Q&A that have to do with some of the rhetoric now that we're hearing coming nationally is about compromise and finding solutions. And so how do we take the activism that we've seen and harness this in a way that brings compromise? A few people have asked, like, can't we all get together about creating more equitable access to both behavioral health and physical health services? Can't that just be, where can you find common ground and how do you build it?
Absolutely. Great question. First, let me start by giving a little plug to Caring for Denver. The Caring for Denver Foundation has just announced that we will be put out our RFP for youth-centered mental health and substance use supports. $10 million will go into the community this year. So if you are really interested about this work and how to support our youth, especially our youth who are activists, please make sure to apply for the funds. It is for you all here in Denver. So, and thank you all for voting for this to make sure that this is a reality. So please go to caringfordenver.org, I believe it is, and fill out that RFP. And youth-led activities are very much encouraged and supported financially as well. So can't let the people do the work for free. I believe that wholeheartedly. But listen, maybe we should find a different word for compromise, because really it's negotiation. And when I say compromise, I don't mean compromising my values. When we passed Senate Bill 217, the Law Enforcement Accountability and Integrity Act, because of the calls of the protesters, I wasn't then gonna turn my back on the protesters and change the fundamental piece of that bill just to get a vote. But then how do you get the vote so that we can actually make real change and not just have conversation? So really it's about negotiation. So I had to figure out at the table, what is important to you? Because, you might not care about qualified immunity, but your big thing is making sure there's body cameras and that this is the requirement around body cameras. So what we did was we negotiated pieces as opposed to just saying, well, I'm going to meet you where you are and come way back here, knowing good and well that I need to move forward if I want to keep my community safe and protect people so that no more kids have to die at the hands of law enforcement, right? So, and then we make the profession better. So it really is about that negotiation. And I know that people are so sick of hearing the word compromise because, you know, they get worried that that means their piece is going to be left out. Or some people want more compromise because they're sick of the division and the divisive rhetoric, right? So what I would say is these are very different conversations. We can actually have unity in our differences, right? And so that's what we did with the law enforcement bill, was that we actually had Republicans from rural areas come in and support the bill. But it was because of negotiation, not necessarily because of compromise, which I think is important. The other piece, though, is that I am not willing to have a conversation with people who are not, or I should say, I'm not willing to negotiate. And this is controversial, to negotiate. I can conversate with whoever, but I'm not willing to negotiate with people who don't believe that racism is real, right? We have to have some fundamental basis for our conversation. If you don't agree with racism, or you don't believe in inequality, or you don't believe in inequities, then I don't necessarily need to negotiate with you. You can vote against my bill if you want to. You can vote against this and push against this if you want to. But if you're not going to be at the table in a good faith conversation, we're never going to find common ground. But if we can agree on some basic principles, we can move forward. And maybe I'll learn some things too. It reminds me of when I was working on a bill around asset forfeiture. And you know, I have to acknowledge my Denver-centric perspective, but also know that my family comes from rural Mississippi. I was working with a man from rural Colorado who was very homophobic, and as an LGBT woman, that was very problematic to me. But I knew he cared about criminal justice issues. I didn't know why. I figured out why, and it's because a lot of folks in rural Colorado feel the same way as people in urban Denver feel about the overreach of law enforcement. And we actually had a lot more common ground than we realized. So in that conversation, we then were able to negotiate and pass a bill that had a lot of support to get rid of asset forfeiture in Colorado for law enforcement, or to change it. And then we were able to have the conversation about his homophobia, right? Because we found that common ground. He realized I was a person. He realized that I wasn't threatening his marriage, which people do believe. And we were able to then have another conversation and build from there. And so it's really interesting because as a woman of color and a queer woman, I have to negotiate that often. I need you to acknowledge the inequalities and injustices that are placed on Black people, and then we can talk. But if you are a white supremacist, right? Or if you are someone who believes that inequities are even good, then I don't necessarily need you at the negotiation table. That's not my role, and I'm not your therapist, right? But if you're willing to give me some basic ground rules, some basic things we can agree on, we can work in that sector together and maybe even learn something about each other. So compromise is a sticky word, and we should have something that's a little bit better, but it really is about this spectrum of negotiation, right? The spectrum of negotiation that we move through every single day.
Right. Dace, a question for you is, as you think about the work of the Denver Foundation, as we're emerging from the syndemic, hopefully, fingers crossed, from both the pandemic and economic recovery, grant making will take a different form, moving from crisis sort of responses to something else. And so how are you thinking about advancing policy and potentially through a platform of more compromise, at least as we're hearing it these days?
You know, I think for us, we really engage in our grant making and our policy work through two fundamental values. One of those is thinking about racial equity, and one of those is thinking about constituent leadership. And so we take a lot of our cues from the community to help us identify what those places are that really will have the most impact on creating a community that that lives in a space that we want it to live in, right? And that recovers in a way that we want it to recover. The Denver Foundation has really just very recently started working in the policy arena. I think we recognized that, you know, we were missing the opportunity to be in conversation. We were missing the opportunity to be in what Representative Herod calls negotiation. We were missing the opportunity to use our platform as a public commons for a place for people to have that kind of dialogue and think about what those fundamental pieces are and what those places are that they can find compromise and that they can find similar ground. And we were missing the power of being a $1 billion organization, coming to the table in Denver and saying, these are things that are fundamentally important to us because the community has spoken to us and told us they're fundamentally important, and because they have a racial equity lens. And so, for us coming into this space is a newer venture, and it's something that we're really excited to be embarking on. We've been we've been working on ballot initiatives, we've been writing letters, we've been offering up testimony, but doing something that's even more powerful than that is really where the Denver Foundation is headed.
Great, thank you. Matt, I'm going to ask you for a concluding sort of comment. You started this frame by saying that as leaders and as we apply the lens of ethical leadership, we need to look at awareness, analysis, and action. We have examples of all of those things integrated throughout the comments of today. Give me some thoughts about how we as a community are approaching this and what do we need to be aware of?
So that's a really good opportunity to reflect, I think, a little on the integration and the almost circular nature of ethical leadership. That you may think you know what the right thing to do is, and as you try to carry it out, you learn things that cause you to go back and reassess your fundamental understanding of the issue, to redo your analysis, and to do something else. It reminds me very much of what we talk about in healthcare in terms of continuous quality improvement. Not just in healthcare, by the way, this comes from manufacturing and elsewhere. There is in the policy and the research arena something like a CQI cycle that probably ought to be going on all the time, where we are intentionally, mindfully thinking about how will we know whether the change we've just made is a change for the good, and how quickly can we learn that? Because in the words of the Silicon Valley entrepreneurs, what you ought to be aiming to do when you're trying to move things quickly is fail fast, right? Yeah. Fail fast, fail often, learn, and then do something else. And so that you're making incremental change, but in at a revolutionary pace, right? And right. I think we often have this debate, and I hear it in Representative Herrod's conversation today, that there is an ongoing debate, even within our political parties, so not even between, within our political parties. There is ongoing debate about revolutionary change and incremental change. And the middle path there may be incremental change at a revolutionary speed. And right. what that means is figuring out how to do these things really quickly. And to Dace's point about what is the role of private foundations, it's to find these things that work and lift them up.
Great. Well, Matt, I'm going to thank you right there. I appreciate that. The sticklers who are needling me about the time. Panelists, thank you so much. Reverend Tyler, Representative Herrod, Dr. Miller, and Dace, thank you so much for joining us here today. We have just skimmed the surface of, I think, really important issues. Javier and your team, I want to thank you for giving CHI the latitude and the flexibility to embark on a project like this. It's really been a gratifying experience for us. And part of that is working with Matt and the Center for Bioethics and Humanities out at Anschutz, and that has been just a really terrific part of this work. The CHI team, a big shout out to Adiran, Alec, Joe, and Jasmine. Thanks for making this all work without a hitch. And for those of you who want to know more, please read the report. That's a companion piece to this panel. discussion. It's available in the chat. It's available on the CHI website, and it's available in your email stream because we sent it to you yesterday. So with that, be safe out there, and we'll see you around Zoom. And thank you so much for your participation today. Be well. Thanks.